Hello, my name is Anil Srivatsa, and my biggest identity today is I'm a kidney donor and I'm alive to tell the tale. I donated my kidney 10 years ago to my brother, and I've taken on a campaign globally to work with groups and clubs, with the Rotary Club, with the Lions Club, to ensure that together we can build a world where no one dies waiting for an organ. Any death because of that is an unnecessary one. And I appeal to all of you to consider this in your lives and to work with the governments to make sure we have a strong law that is patient-centric and assists patients to survive and families to be healthy together and live a long, beautiful life together. I have been driving around the world in my car with my wife, Dipali, and we do this so we can reach small towns, small villages, big cities, unlike if we did this by airplane, which will go only to big city. And everybody deserves a chance to know about how their lives can be saved with organ donation. So this has been our mission for the last 9 years now. And I am setting off on my Africa journey, starting here in Kenya, going around the Cape into West Africa and into Europe to participate in the World Transplant Games. I would love to see Kenya have its own team participate in the World Transplant Games. And if anyone would like to become a team manager, talk to me because I can make that happen. Because the more people that see heroes, it inspires them. And you have plenty of heroes here in Kenya who have donated an organ or have received an organ and have survived very well and are fit to be an athlete for your country. So let's have Team Kenya. And in Germany next year in August, call me, talk to me. You can find me on my website, on my social media handle at Gift of Life Adventure Foundation. At Gift of Life Adventure. Write to me and we can make this work.
What are the biggest myths and beliefs that cause people not to donate their organs? And what are you doing to demystify?
Myths are nothing but a manifestation of fear. And the moment you answer questions, that fear dissipates, and so does the myth. What I'm trying to do is increase the information level of people who don't understand what organ donation is, and normalize the conversation enough for them not to be afraid of it. And that's really been my mission. What started me off on this journey was my personal experience where my brother suffered from end-stage renal failure, or CKD. And I was given the opportunity to save his life so he can continue to live a quality life. I have not sacrificed my kidney to him. You sacrifice things that you miss in life. I do not miss my kidney. I gave it out of love for him, and we both live together with a loving bond. And why should anyone else be denied that kind of existence? So I used my training in the broadcasting and media industry, of which I'm a part of, to continue talking about this subject so others who are brothers and sisters and friends and aunties and uncles and mothers and fathers who can share the same experience my brother and I share today, that is a loving bond that happened because an organ was donated.
So what is he today as we speak?
My brother is a neurosurgeon, and he does at least an average of 2 or 3 surgeries every day for the last 10 years. And he has saved more lives. So you never know who you're going to save, someone who could change the world perhaps. Not your world, but someone else's world. And that's worth every organ that you can donate. You're talking about my brother and his philanthropy. Well, he does a lot of free surgeries, his way of paying forward for the gift he received out of the love from me, and now he wants to pass on that gift and benefit to the people that he can sometimes treat that can't afford his treatment. I was on my way to Masai Mara, and I happened to run into a grandfather who appealed to me to see if I can help save his granddaughter, who is 13 years old, living in Narok, Joyce. Joyce is a vibrant 13-year-old girl wanting to go to school and wants to become a doctor, but health does not permit that. Her kidneys are failing gradually, her spine is failing her, and she has several complications out of other childbirth medical conditions. She stole my heart, and I want to do what it takes to help Joyce get treated better. If we can help treat Joyce, who wants to become a doctor, that would be the best life to save. So join me in helping Joyce come out of her predicament, helping her mother and grandfather who are supporting her today to be able to get self-sustained, educated, and healthy.
Can you educate us on what organs one can donate while alive, while dead, and what impacts they have?
The organs you can donate while you're alive most commonly are kidney and liver, but you could also donate a part of your lung or your pancreas. I think even the small intestine, but don't quote me on that. But for sure, your liver and your kidney, which is the most popular of every one of them. What you can donate when you die with a cardiac death. Of course, Google will give you that answer right away, but to give you that answer right now, you could donate your skin, your bones, your pancreas, your small intestine, your heart valves, your corneas, your limbs, your entire arm, your legs, and your bones. But when you become brain dead, God forbid, there's not too many of that happening, and thank God, is when you are in an accident and you injure your brain with a head injury. That means your brain has died and your heart is still alive and your blood is still pumping. At that point, if the family consents, everybody can save 8 lives at least. So for that you need strong laws in the country. I'm not sure Kenya has a deceased organ donation program yet, but it's never too late to have that, because a healthy nation is a prosperous nation. And organ donation will keep you healthy. With 4 million people in Kenya suffering from kidney disease, that's 4 million people who cannot be productive in your society. It is an expensive disease. Dialysis is expensive. It costs the country a lot of money. Transplant is an easier expense to bear. And you will have healthy living people who will contribute to the tax base of this country. So understand the economic impact of a transplant. Well, there are 3 aspects of organ donation that I work with. One is called awareness, which is why I drive around the world, letting more people know about it. The other one is advocacy, where you need to make the governments understand or help them be more patient-centric. A lot of laws are designed around knee-jerk actions when there is some violations where, for example, organ trafficking continues to happen. Then the laws become so tight that it even prevents legitimate patients from having the benefit of the law. If you have patient-centric laws, you will have less organ trafficking. It's just logic. Organ trafficking is not 50% of the business. It's less than 10%. But the news media covers it to be so vast that it's not the truth. 90% of the population do it legitimately. Don't punish them. The laws we tried to change in India, my organization called the Gift of Life Adventure Foundation and the Rotary Club, some of us Rotarians, we are Rotarians as well. We moved the Supreme Court of India to change a domicile law that allows today anyone in India to get on the registry for the waiting list anywhere in the country. Till that point, you had to be a domicile of a particular state, and you could only get on the registry of that state. But that has changed now. The no objection certificates that we need from our governments, even if 2 brothers want to donate to each other, that has gone away. Spousal consent has gone away. Where earlier when I donated my kidney, I needed my wife to give me consent. Today, spousal consent when donating to a near family member has been taken off. So these are the strides you make when advocacy becomes strong. And if there's a government who is willing to be more patient-centric, then there's a medical community that's willing to be more patient-centric, and society is willing to be more patient-centric. You have one common goal, is being patient-centric, because you never know who that patient is going to be. It could be you. Don't fear organ donation. It can save the lives of someone you love, and God forbid, even sometimes your own. Speak to your doctors. Speak to people who've been there. I've been there. I speak with credibility. I speak with conviction. I'm not the first, I'm not the last. There are millions who have done it before me, and there will be millions who will do it after me. Are you one of them? That's the question to ask yourself. From here, I move on to Uganda, Rwanda, if they allow me. Again, it all depends on the visas I get, so I'm trying to work it out. But the plan is to go around the Cape, into Cape Town, into West Africa, and go into Germany to compete for India at the World Transplant Games. I have traveled with my wife about 60 countries so far for the last 8 years. And hopefully a successful trip this time will see me reach my 100th country.
The Lions Club of Nakuru is actively involved in harvesting of the cornea. Whenever anybody within our community passes away, immediately there is a team which rushes to get the consent from the family, and we immediately activate our team from Loresho Hospital, Nairobi, to travel to Nakuru. We harvest the corneas. They rush back because there is a time frame within 6 to 8 hours they have to be back, and the cornea has to be harvested into the recipient. Now, for every cornea which we harvest, it is from what we hear now that it can be split into 3. So if from one eye you can give out eyesight to 3 people, and the white part of it, if the family agrees for us to harvest, which is called sclera, 17 more people can regain their eyesight. So in total, from one eye, we can give back eyesight to 20 people. So if one is from one diseased person, from 2 eyes, we can restore eyes for 40 different people. So it's a very big donation and a noble cause, and we are trying to pass this message to the community, different churches, different mosques, that if at all they can pass this message during the Sunday sermons or Friday prayers, that when somebody passes away, please contact the Lions Club of Nakuru through our chair lady. We will activate our club, and we will make sure that they are harvested, and we can restore the eyesight of. We have, I think the registered number of people whom we have is over 75,000 who have registered for the eyesight, who are completely blind. But I'm sure the number could be far more than 75,000.